Patients who visit the hospital also have a right, the right to get to know why they are being treated, what they are being treated for, what sort of drugs they are being given. And the question about the rights of the patient has always been coming up and being dealt at the civil society level, especially in a society where, well, medical people would think that patients don't have a right to ask questions at all just because they are not experts. We have a lot more civil society organizations that have come forward in the last couple of years to empower or create awareness for patients who go to the hospital to be given the platform to ask questions and also have the right to know. One of those agencies, that is the Health Concern Ghana. It's a civil society organization. They deal with issues of rights of patients who visit the hospital or other health facilities. And they are in the studio, represented by Isaac Ampoma, to give us their own thoughts about not only the patient charter, but how the medical facilities and the medical doctors and the other medical professionals tend to follow through with the tenets of the charter. Now, particularly when we've had a lot more concern being raised by what happened at the Konfanoti Teaching Hospital, that has also led to perhaps, if not a disruption in services at the obstetrics and the gynecological department. You say that the right of the patient is always critical.
Well, I think indeed we need to emphasize the right of the patient. The Ghana Health Service, for its own effective service delivery, has stated why the patient charter needs to be adopted. They have enforced that health facilities see to it that at least the patient charter is clearly outlined, one, to the families and clients, and also to the patients themselves. Not only the patients, but also there are responsibilities also of the patients that should go along with the right. So the Ghana Health Service has set 4 pillars, and these are, the charter is made to seek the right of patients in Ghana, and it addresses, 1, the right of the individual to an easily accessible, equitable, and comprehensive health care, and also respect for the patient as an individual with a right of choice for decisions, and also to ensure that at least the patient has some level of protection, and finally the responsibilities. All these pillars has been itemized in detail, so maybe we can go into it and pick it clause by clause.
Okay.
As to
now, we know that when you get to read the charter, you get to know that the patient has certain rights. For example, let's take them one after the other. Why I have to be treated for a certain ailment at all. If we'd have to take some of those rights into consideration, before we discuss them, do you think that our society, since we started creating awareness about the charter, has been very receptive?
Well, I think the society is ready to respond.
What about the medical community?
Exactly. But then it is up to the facilities to ensure...
That's the medical community.
Exactly. To ensure that these charters are enforced. You understand? It is hard to even say that some of the facilities don't even have copies of the charter, which is very sad though. So civil society organizations are encouraging facilities to make sure that this health charter is explained on daily basis. Because sometimes you go to hospital, you see within the outpatients department, a whole lot of families and their clients are waiting for consultations. These are opportunities to be able to explain to the patients their responsibilities, to explain to their patients their rights, so that at least within the clause there is a right of complaint, so that individuals do not carry the law into their own hands and take certain actions. So it is incumbent on health facilities to make sure these things are enforced.
Why should the patient know why he's being treated? You've been to a medical facility. You want to be treated. What's your business? You're not a medical doctor. I mean, you should have the trust and know that the medical person will take care of you.
I think in a democratic dispensation, so to speak, fundamental human rights are are part of us. We need to have our own rights. It is for us. So once we have accepted to enter into a democratic dispensation, then there is the need for us to also demand for what belongs to us, and also, especially coming from service delivery. Services needs to give us the best because we are paying for. So if services is being paid for, then I need to ask for what is best for me. So within the Patient's Charter, we have clauses which also emphasize the right of the patient to seek other medical services, the right of the patient to seek information from the patient, from the doctor, and also the right of the patient to even know who is attending to him. So the health practitioner needs to be able to explain himself. But what do we see? We go to hospitals and the patient is seen as he has no right to even communicate with the doctor. So that is the gap, which I believe when we go into the details of the Patient's Charter, we'll know specifically which clause enforces all these areas.
Yeah. And let's talk about the clauses. Just take us through.
Right. I have them here. The first clause, which talks about rights, says the patient has the right to quality basic health care, irrespective of geographical location. What this means is that every individual patient has the right to quality basic health care, irrespective of where you belong to. You can be in the north, you can be in the south, you have access to quality.
We do understand that, and I'm very particular when I was reading. What was going through my mind was issues about universal access. Now, we have national health insurance and how patients would tend to access it because they are subscribers.
Right.
And sometimes people have difficulty accessing their treatment when they go to other jurisdictions, just because of the biases or the nuances of how the services are delivered. As a health charity, has it come to your notice? And sometimes how do you deal with it?
Well, these are bottlenecks within the system. The National Health Insurance Scheme itself has its own challenge.
Because it's supposed to be universal.
Naturally. But then within the system, the National Health Insurance Scheme has also given exemption clauses for some people who cannot afford. These are disabled people, these are indigenous communities, and those people, even the Patient's Charter also explains it. Where there are exemptions, you need to enforce it. So I believe these systems are being enforced, and of course it is up to the civil society community to make sure that those within the indigenous clauses, the vulnerable and the disabled, also have access to the National Health Insurance Scheme.
Yeah. And do you think that we'll come to the point where the patients themselves know their right? What are some of the inhibitors in creating awareness among the population, that they also have a charter, and when they go to the health facility, they can always ask questions?
I think the Ghana Health Service in itself also echoes an optimal healthcare. Optimal healthcare, they are relying on teamwork and collaboration. They specify that there should be the collaboration between the patient, there should be the collaboration between the health workers, there should be the collaboration between other health providers within the system. So it is therefore incumbent that each party needs to ensure, which is the client or the patient, needs to ensure that he is also demonstrating his right, and also the providers also have to ensure that they are also demonstrating what is expected from them to the patient, so that the two can work together in order to achieve the optimal health that we are looking for.
Let's come to the responsibilities there are for the medical professionals before we come to the responsibilities for the patients. If a patient comes to the hospital and the patient is not very much aware of what rights he or she has as enshrined in the charter, is it by compulsion, or is the medical professional compelled to perhaps even outline what those rights are to the patient before even treatment is started?
I think for a collective growth, irrespective of the fact that the patients may not be aware of rights and responsibility, as a professional, you could create that environment of engagement, so that even at that level, there could be a certain level of education for the patient who is not aware. And again, also as a professional medical staff, I also expect that you could also take that opportunity to engage the patient to find out, even if he's aware. So once you realize that the patient is not aware, then you are evaluating your own system as to whether it is effective. Because when the patient is aware of the charter, it helps the system to develop together. Then the issue of mob, the issue of trying to find out the information ourselves, the issue of, creating or taking the law into our own hands will not happen. You understand? Sometimes we wait until the unexpected happens before we try to find out where the fault is coming from. So I think it's a collective engagement that we need to do. The health practitioner, the medical doctor, the patient also needs to engage each other so that we could all learn together.
And if we have to go forward on the subject of what the responsibilities are for the patient, what are those?
The Ghana Health Service has also outlined the responsibilities in details. I guess I have some of them here. He said the patients are also responsible to provide full and accurate medical history of his or her diagnosis so that the doctor will be able to give the right medication to the patient. So in that case, the client or the patient needs to tell what is really worrying him or her. So then it informs the doctor what to do. Because then if you give wrong information, then it becomes difficult. You get a prescription which may not solve the problem you are going through. Now, the second one also is that the patient shall request additional information and clarification regarding his or her health treatment. So this is a complete responsibility. You have the right to ask. You have the right to demand the information. It goes on and also says that the patient shall comply with prescribed treatment, reporting adverse effects, and adhering for follow-ups. The fourth one also says the patient shall inform healthcare providers of any anticipated problem in following prescribed treatment. So if there should be any side effect, you have the right to go back to your doctor and engage. So these are all spelled out. When it comes to the 10th of the charter, it speaks a lot, but I think that is the right. But then again, on the 6th of the responsibility, it says acquiring knowledge on preventive and promotive healthcare. No, we also have the responsibility to avoid illnesses. So therefore, it is our responsibility to make sure we drink more water, we eat more fruits, and all that. So the patient charter in itself is there to
because the patient is supposed to adhere to certain policy guidelines when they go to the health facility. Don't smoke, don't do all that. We do understand that. Now let's take the instance of what happened at the Comfort Teaching Hospital, or such scenarios. And sometimes we have sporadic reports of such, very sparse though, not as if it's often. In this instance, what happens? A patient is reported to have signed the consent form that my child is stillborn. Well, and then was it that the communication was not right, or sometimes it doesn't?
Well, I think
it's not well stimulated.
Yes, I think as a country we need to be responsible for whatever happens. We should not blame only the mob, neither should we blame the doctors for embarking on a strike as a result of this. Maternal mortality in itself and infant mortality within the MDGs are a concern for all of us. Now, if a child dies during delivery, it's a big blow to the nation, not only the family concerned. So I believe the information requiring is that what is the cause of the death of my child? And therefore, where is the body? So this is information. So if these informations are well tailored, if these informations are there for the people to assess, I believe all these things will not happen. So it is therefore incumbent on all of us to make sure that systems are well structured, information is given to the people so that they can easily demand for it.
In your interaction with communities and various minority groupings, etc., do you get the feeling that the more you go into societies where perhaps literacy levels are not high, it means that you are likely to have distortion of what the tenets of the patient's charter says?
Yes, in a way you could attribute to that. But again, there are also civil society groupings within various pocket areas. They are also to ensure that where the literacy level is high, the civil society community could then engage these groups in a language that best meets their understanding. So some NGOs are doing well. Star Ghana is supporting some NGOs to ensure that the Patients Charter is within the hard-to-reach communities, so that they will begin to understand, they will begin to engage. So it is, like I say, optimal health is a collaboration of all. So we all need to speed up our effort and ensure that these things are...
Okay, there's a patient charter. I'm supposed to know my rights as a patient when I go to the hospital for treatment. The medical professional also knows it. There's that interaction, etc. So on that very platform, we're all equal. Right. How that promotes good treatment and healthy living?
I think it's very significant if informations are shared across board. Sometimes when the patient begins to know his rights and of course also follow his responsibilities, and then the duty bearer or the service provider also does his bit, it helps us a lot. One, I believe it could even help us minimize the influx of outpatients, because sometimes some of the illnesses should not even go to hospital. Just a normal exercise, just taking in certain fruit juice and other, normal drinks, just as the patient charter says that we have the right and responsibility to do preventive health care and also to do promotive health care. So on the part of the health service, they are to tell us how to prevent illnesses. So collectively, when we all work together, I believe it will help us.
Does it mean that you have observed that there's still some level of animosity in the relationship between what the patient and the medical professional should be?
What findings have proven is such that sometimes the health worker do not react well to the client or the patients. Most findings has revealed that most of the health workers relate unfairly. This needs to be investigated further for us to believe that it is true. Again, also, some of the patients also have their own challenges. Once a patient believes that he is sick, he needs attention, he doesn't also put into consideration what goes into who a health professional is, his economic status, because a health professional also is an individual who needs to be well paid, well taken care of. So if these factors are not well shared amongst them. So I believe there should be the time for the health professional to say, well, this is this issue. I'm the only doctor here, and I'm attending to all of you. So there is pressure. Yeah. So if that communication can be able to establish, the patient themselves will begin to understand the issues at stake, so that there wouldn't be any blame game here, there wouldn't be any insult here. Collectively, we work as one people, and we grow this country together.
We're getting to a stage in society where we have a lot more section of our population that are being plagued with a lot more chronic ailments, and we have a lot more cancerous ailments that are plaguing a lot more people, and these require specialized treatment from the medical professionals. Many patients don't have any knowledge about. How then does the patient ask a question at all?
Well, I think it's very broad looking at it. I think the doctor-to-patient ratio is indeed a challenge for all of us. As a country, I believe we need specialized expertise within the medical fraternity, and government needs to also invest more into that sector, so that at least, like you said, certain chronic illness, for instance, mental health, which of course becomes one of the serious issues. You see a lot of mental health people on our streets, and when we have specialized, people who can take care of mental health, I think it will help. Not only that, cancerous diseases and other ailments. Government really needs to look at that and also invest more into it. So it's a big challenge. It's a big challenge.
Because I'm asking this very question, for example, you have a serious tumor or something, and, well, they go through all these processes, chemo, radio, or whatever it is that they go through. The drugs are also sometimes way out of the league of the knowledge level of the patient. How then does the patient becomes conversant with what a treatment mode is, the sophisticated nature of the treatment, and the type of even drugs that they are offered, because they have no clue?
Right. I think within the patient charter, it's also specified, much as the responsibilities and rights goes hand in hand. The patient charter also emphasizes that should you engage any side effects, please report to your doctor. You know, so then civil society communities within communities should make sure that specific findings are gathered among these, and then shared it during, you know, annual review programs within the Ghana Health Service and Ministry of Health, to also take actions as to whether communities are responding to side effects of medications. Again, also, individuals have the right to alternative health care, which the right specified. So it's all education. It's all of us, teachers who have, families needs to help each other to be able to make sure that we all help grow our country.
If you interact with the various civil society organizations like yours and even the medical professionals themselves, you get to have the feeling that at the bane or at the center of it is all the issue of communication. How is that crucial to resolve some of those difficulties or perhaps the misconceptions there are in the relationship between a medical professional and then a patient?
I think as a country we are growing. Ghana is almost 20 years in democracy, and as such we need to change the way we do things. There are e-health, electronic health. We need to grow to a point where we should be able to communicate using our laptops and our mobile telephony in engaging our health practitioners and our doctors, so that communication can easily get to reach us. We should be able to have the contact details of our doctor when we go to hospital, for us to easily text complications to the doctor on the phone. And this, I believe, when we try to expand the level of communication, it helps all of us. But then if it is still at the level of, you know, seeing the doctor, going through the process,
which is currently,
it becomes so cumbersome. And of course, there are frustrations, you know, somebody demanding the body of his baby. For one reason, he has the right to see the body, because there are rumors peddling that some nurses have condoned to steal the baby. So imagine such information is out. How will the individual feel? You know, but then that is not the right process. There are mediums in which you can channel complaints. So all these level of communication needs to be engaged. Religious leaders, community leaders, civil society, we need to find a way of, you know, communication. Thank God there's a right to information bill. We are praying that it becomes law effectively, so that we could then begin to demand what
okay, so you're saying that it is important that there's clarity of information dissemination within the hospital or the patient to medical professional treatments setting,
yeah,
right?
It is very pivotal.
When you move out from more urbanized areas where we have a lot more people who are enlightened and unaware, and you venture more into the countryside, do you get the feeling that the awareness level about what the patient charter is reduces?
It is a big problem, even within the urban areas. Many don't even know. So then you take the deductions from there. So if within the urban areas, the level of the patient's charter understanding is limited, let alone those within the rural areas, then it becomes a big challenge. So I think I will encourage the Ministry of Education to even inculcate the patient charter within the syllabi of education, so that much as the young people grow, they begin to know. Within community debates, the patient charter needs to be engaged, and also the health directorates at the various sectors needs to use the patient charter as one major subject for discussion during their beds during forests and all that. Civil society groups also need to embark on research to find out the level of understanding of the patient's charter.
Would want to open the phone lines, get to know what the feeling is among people, let's say our various audiences who have gone to the medical facilities and what the experiences have been. And very soon those numbers will be on your screens and you'll get to know what the numbers are. Please interact with us. Tell us what the whole feeling is. What have been some of your experiences? Do you think that at all the medical professionals that you have engaged with know the tenets of the patient's charter? Of course, many of them may know. Do they respect it? And how do you think that information at the countrywide level needs to be disseminated to make sure that a lot more patients know about what the patient charter is, the tenets of the patient charter, and how the various stakeholders need to follow through what the various contents of the patient charter is? I'm still continuing the discussion with Isaac Ampoma. He is with Concern Health Ghana. They are a charity involved in health information dissemination in communities, in the communities in which you operate.
That's right.
What do you think are the most prevalent need for which people are not able to adequately access health in the facilities that are around them?
I think most of our experiences have shown that the partnership, that fruitful engagement between the health worker and the client is what is the issue. Because always when you engage the health worker and the client, he has something to say. I went there with my national health insurance scheme. They were not looking at me. They were not listening to me. But then somebody came and they listened to the person, So these are issues we need to look at. But within that also, I think in recent times a lot of engagement has gone on. And the health workers are doing well.
We have Justice from Keta. And Justice, a very good morning to you. We're discussing the patient charter this morning and would want to know what your experiences have been, particularly with you having visited the hospital or medical facility, and what your experiences have been at all.
Good morning, Roland. I want to correct something. I'm calling from Tepa, not Keta. Tepa, rather.
Keta?
Tepa, I mean.
Tepa.
Yes.
Okay, Tepa. Okay.
Yes.
Okay, please continue. What have been some of your experiences in the health facilities you have visited in your community?
I really like the program that is going on. This is really a problem. Personally, I have had some encounter. Actually, I visited one hospital one time. I have seen this. I thought it was an isolated case. I even did not know there is something like that as a charter that actually informs the patient as to what your rights and your responsibilities are. There are times when you go to hospital, you see these extracts sometimes pasted on walls, and I believe when he was reading, I was able to make out some of these things out of them. Sometimes I've come to realize that even in such cases when they have them pasted on walls, it's something I believe that the doctors should have known. That in such situations, you go and you seem to ask questions, and it looks as if you are there either to challenge the doctor or, I don't know, I just don't know what is going on in this country. So I believe it's high time we make time for this. For me, I would suggest that in our schools, we should begin inculcating these kind of things. We have the various health subjects that we do. And it's high time, I think we infuse some of these things into it so that as time goes on, the generations will now come to know that these are some of the things that we are supposed to ask questions about. And we have the right as well to ask such questions and such responsibilities to undertake. Thank you very much.
Well, thank you very much, Justice. Now, Justice is hammering on a very crucial point. When you go to the medical facility, because the doctor feels that, well, I've been to medical school, done specialist training, etc. Who are you to question me on what I'm supposed to do as a trained specialist or a medical doctor? Have you encountered such issues?
Yes, it does happen. It does happen. But I think also going back to what Justice just said, there are public health departments within specific hospitals. Now, the public health departments are to see to it that certain educations are enforced within the health facilities. Most of them are attached to the health facilities. So I believe, like he said, it is time those public health facilities, the doctor, for one reason or the other, because of the number of clients on him, and also the fact that the doctor to patient ratio is very limited, it will be very good that the public health departments within the various health fraternities pick up what they're supposed to do. They are supposed to disseminate information. They are supposed to educate the people, you know. So they need to pick up those issues and engage. They should also complain if there is no funding. They should tell the civil society community for us to advocate for them.
We have Eugene from Wale Wale. Very good morning to you, Eugene. What has been some of your experiences?
Yeah, good morning. Yeah, I feel so happy with this program. But sometimes the experiences I've seen in my locality, you see, most of the time you see that the nurses will be speaking as if those that they are speaking with are not patients. Sometimes shouting and doing a lot of things which is not good to be interacting that way with a nurse, with a patient. As you see that if I'm a patient and he speaks that to me, maybe it might hurt me, and I'll feel more bad.
And Eugene, when you visit the medical facility, do you get the feeling that perhaps the medical professionals feel that, well, they have gone to school, gone through some rudiment of training, and so they are the overall bosses and know what they are doing?
Yes, I have seen it, and that is why I'm saying too. Because they feel superiority. Because of that, they just be shouting, especially to those who have not gone to the Q1. You see that? They will be shouting on them.
Do you get the feeling that also, because perhaps Wale Wale is not as developed as in Acquah or Tamale, perhaps also you have that very level of service delivery among the medical professionals to patients?
Yeah, it can also be counted because that is it. We are undivorced place, and maybe the nurses or the doctors, we have only 2 doctors in the district.
Okay.
Yeah, with some of the nurses. And it's the nurses that are just speaking that way. They feel superiority.
Okay.
You understand that?
Yes,
so
I do.
Pity for the patient.
Okay. All right. So that way, then Eugene is our last caller for this very discussion on the patient's charter. Now, just 20 seconds from you. What's the way forward then?
I think the way forward is clear. The patient-client communities need to know the pressure on health workers. Health workers should open up to patients so that there shouldn't be a gap within information. When we get to know what is your problem as a health worker, and then you also listen to us, we become one family. Okay. And then we all grow as a country.
So, thank you very much. And we've been interacting with Isaac Ampoma. Isaac Ampoma is with Concern Health Ghana, is a health NGO, and they've been looking at issues of patients' charter and what there is by way of strengthening health delivery to patients in other societies, especially those just beyond the urban communities we have in the country. Thanks for joining us, Isaac. We hope to have you again for a more lengthy discussion on the subject. Next, we look at my community, and we're coming to a community near you. It's up next.